Well, our practice has changed unrecognizably since the beginning of this pandemic. Number one is that the many endocrinologists, as they are general physicians, so they were redeployed to look after the inpatients who are admitted with COVID or COVID-related severe illnesses. And as we were doing that, so we recognized early that there's quite a significant portion of them had diabetes as a comorbidity. So even prior to the COVID pandemic, so about 25 to 30% of people who are as inpatients in a hospital had diabetes as a comorbidity. And as you know, majority of them have type 2 diabetes at 90% or so. But as the COVID pandemic increased, and though that number increased in some hospitals, but that number remained the same. And as the mortality the figures started coming out due to COVID, we realized that a significant proportion of people who were dying due to COVID had diabetes. And this number was higher than the percentage of people who are inpatients, due to COVID as well. And the second thing there was, and we started recognizing, the people with no history of diabetes prior to hospital admission also had high glucose levels when they came in. And some of them, the glucose values were high enough to give them diabetic ketoacidosis. And this perplexed people as well. So to give you a spectrum, there was one subset of populations who had diabetes. They were high risk of severe complications due to COVID, as well as increased risk of death due to COVID. And second, people who had no history of diabetes, getting admitted with diabetes-related complications. Of note, the people who had diabetic ketoacidosis, they were not people who would behave as if they had type 1 diabetes. These were people with previous history of type 2 diabetes, or people who had no history of diabetes, and the phenotype would match with people who are at risk of developing type 2 diabetes as well. The another issue that came up early on is that, what is that is making these people at high risk of dying or severe illness due to COVID? Whether it is their obesity, which is putting them at a high risk, whether it is the other comorbidities associated with diabetes like hypertension, or these are medications that they're taking because of their diabetes. And one of the early contenders there was ACE inhibitors. So because one of the receptors that COVID uses to get entry into the cells is an ACE2 receptor, which is ubiquitous, present in many organs, including the lungs, where we see the major response, major damage. And whether it is the increased expression of these ACE2 receptors, which can occur in people with diabetes or people who are on ACE2 inhibitors, is it responsible for it? Again, we have got a decent understanding that it is not due to ACE2 inhibitors. So there are various guidelines from international societies to support that. But at the same time, whether it is obesity or is obesity a pro-inflammatory state, and that is kind of adding fire or fuel to the fire. It's called a cytokine storm that comes on, and then that creates the risk of new diabetes onset or to worsening the underlying the diabetes state. So we don't know the answers yet, but what is established so far is that people who have got diabetes are at a high risk of severe illness due to COVID and at a high risk of death due to COVID. And this is in all populations, but within the subset of people with Black and ethnic minorities, and especially South Asians, the risk seems to be much higher. So if they have got underlying obesity or if they have got diabetes. So one particular caveat among South Asians is that, so if they have got diabetes, irrespective of whether they have got high BMI or not, so they are at a higher risk of developing severe COVID disease and at a risk of dying due to that. And compared to the white population, that risk seems to be at least 2 times or more, so in people with a South Asian background. And the other disturbing factor is, among the South Asians is that so they tend to be at least 10 years younger, so compared to their white counterpart when they get admitted to the hospital or die due to a severe COVID infection.